What's up, everyone? It is Tuesday. I hope everyone is having a great start of their December. I cannot believe it's literally 22, 23 days away from Christmas. This year has flown by. But today we have the special privilege, Tesla owners of Silicon Valley. We're going to be honored to speak with Jake, Neuralink's seventh patient. Jake has become a powerful voice in the brain-computer interface world, sharing his journey living with ALS and how Neuralink is expanding what is possible for him and others. Quick shout out to Insta360. Steve and I are both using Link 2 and 2C for our cameras recording this interview today. Steven, to you.
Yeah, sure. So for anyone who isn't familiar with Neuralink, they create brain-computer interfaces. These are implants that actually read your neural activity, and then they let people control devices with those thoughts. Their N1 chip, it uses ultra-thin threads that connect signals in the brain to external hardware, kind of like telepathy. Now, today we're going to explore Jake's path, what life was like before ALS, why he chose Neuralink, how the implant works, and what his daily life is like now that he has it. Well, Jake, thank you for joining us. Welcome.
Hey guys, how's it going? Thanks for having me.
Yeah, thanks for coming on. I know we all have busy lives and things like that. So we are super excited to get here and spend time with you today. But Jake, we know Steve and I know a little bit more about your story, especially as we were preparing for this interview. But to our audience who may not know you and your story, tell us a little bit about yourself, where you're from, what your life was like before the diagnosis.
Sure. Hey everyone, my name is Jake Schneider, also known as patient number 7 in the Neuralink N1 trial. I'm 35 years old. I'm from Austin, Texas. I live here with my dog that you probably just heard bark, as well as my 6-year-old son. So things are kind of constantly in motion around here. I was diagnosed with ALS February of 2022. And before that, I was an otherwise 31-year-old healthy male. And I was working professionally, I was a surgical device representative. So I represented a device that's it's an ablation device used for the treatment of uterine fibroids. So I would go into the procedure room with the surgeons, teach them how to use the products, show them how to use it, troubleshoot, etc. And things were going really great, honestly. My son was born in 2019, April 2019. I built a brand new house here in Austin. We moved into that house in December of 21. And so the kind of things were really going my way. I felt like I was really carrying myself with momentum, as I went through everyday life. And then, I developed this muscle twitch, a muscle fasciculation in my left bicep. And I, for the longest time, I just put it off saying, I'm probably dehydrated. I need to drink some more water, eat a banana. But it persisted, it didn't really spread anywhere, but it just persisted constantly in that left bicep. So I went to a neurologist and got it checked out. And after a 45-minute in-office visit and an EMG test, I was told that I have 2 to 5 years to live.
Wow.
And I wasn't expecting this. This is the least thing I was expecting. I was thinking maybe, a pinched nerve, a herniated, something, not this, And when you're told that, when you're just how do you quantify that as a human being, without any other, explanations or possible causes. They were like, yep, this is what it is. So my world was completely turned upside down overnight.
Just for people who might not know enough about ALS, or I guess somewhat more commonly referred to as Lou Gehrig's disease, right? How would you say that initial kind of muscle twitching to the diagnosis to actually having an impact on your life? What were some of the big changes that actually occurred from the diagnosis to the point where now today you're a Neuralink patient? But what was that progression like? Just kind of painting that picture for people.
Yeah, and so like when I did my initial research of ALS, I was reading, okay, a disease state affecting an older population, and people, when they first have symptoms, they're either tripping over themselves, having problems going up and down the stairs, fumbling pens, dropping things, stuff like that is typical symptom onset. For me, I didn't really have any symptoms that were present other than that muscle fasciculation. So my day-to-day life, outside of just trying to wrap my head around this, didn't really change much at all. In fact, I probably spent that next year after diagnosis in complete denial. I buried myself in work. I was traveling a lot because if I was out in the world and people didn't know that I had it, well, then I didn't have it, you know? And I was able to fake that for about a year. And it's not something that all happens at once. It's slow things. Like, one day I was getting dressed at the hospital and I noticed that my scrub pants were harder to tie, or my OR mask was harder to tie behind my head. Those sort of things. And then my symptom onset from there, it spread to my shoulders. So the first thing that I really noticed was the muscle weakness. So like lifting things that I used to be able to lift up with ease were all of a sudden, very difficult. And then I think I remember, I was like reaching up in a cabinet and I dropped a plate out of the cabinet, while I was getting it. So the ability to lift and, bear weight, that sort of thing, that sort of diminished slowly over time. For my shoulder weakness, that spread down to my arms, and then eventually my hands. So when my hands were completely compromised, I couldn't lift or grip a pen. And now I'm kind of experiencing like my gait is starting, the way I walk is starting to be affected. So it's those little things that you pay attention to every day where you're like, okay, is this the last time I'm going to be able to do this? Or I just tripped over my shoe. Was that just because I tripped over my shoe, or is that the ALS? So it's like this never ending game of guessing of like when the other shoe is going to drop, because ALS is a disease of exclusion. So you kind of look for everything else that could be something. You're looking for a smoking gun somewhere. But if you can't find anything, it all kind of comes back to ALS. And currently, there is no cure for ALS. There's a couple FDA drugs on the market. And then the protocol is that I go and see my provider every 3 months in a multidisciplinary clinic. So I see the neurologist, I see the physical therapist, occupational therapist, speech therapist, respiratory therapist. And that's all they can really do. They say, okay, we're going to write your measurements down. And then 3 months when you come back, we'll tell you if you're any weaker or not. And that's all there is. That's it.
Yeah. So it's almost like there's really not been any big breakthroughs in this space. Well, first off, do you guys want to say I'm sorry to hear this? I mean, I've heard your story, but just to talk to you about it live, it hits different. But how long would you say, like, for you when you got diagnosis to things really starting to, let's say, where you had to make, real adjustments in your life, how much time went by for that stuff to start steamrolling? Because I think you said, you were still working like as usual for a year. And
Yeah.
also too, with ALS, is it different, the timing different for everyone essentially,
Yeah,
as
it's
far as
very
like
good.
what speeds up and stuff
Yeah,
and slows
that's
down?
a very good question. So to answer your first question, I'd say it's probably about 18 months, after my initial diagnosis where, I have to, that 18-month period is when I really started to have to make adaptations to how I do things, you just figure out different ways to do things to compensate for the ability that you've lost. And for every person, it is different. Everyone has their own unique progression um, template and what that looks like. Historically, people whose symptoms start in their legs, that's more common. Those people, I believe, tend to progress a little bit faster than when they have and starting in your upper limbs, like I have. Um, and it's really like the physical symptoms as they start to diminish. The thing you really need to look out for is your breathing. Once your breathing numbers start to drop, that's kind of indicative of you're going to start sliding, and declining pretty quickly. Fortunately for me, my breathing numbers are still very stable and steady. So for like the last 9 months that I've gone to my clinic, my numbers visit to visit have kind of remained steady over those 9 months. So the best of a worst case scenario, I guess, if you want to kind of look at it that way. But um, yeah, that's what they tell you. They say everyone's different. I don't have a crystal ball. I can't tell you what's going to happen. It's just kind of stuff like that. And working in the healthcare field, I was I was shocked at how little the field of neurology has innovated in the last 100 years.
Yeah. Well, Jake, thank you for shining a light on ALS. So we've spoken so far with 2 Neuralink patients that actually have ALS. So now you're the third that we've spoken with. Each time, I mean, like I said, I thought I knew enough about it, but clearly it's very, very little. So appreciate you shining a light on that, sharing your personal story too. Just makes it understandable for people that this is not something you're necessarily born with, but it just can happen at 30, 31 years old. It's terrible. So, but I appreciate your vulnerability and sharing all that. On to Neuralink. How did you end up hearing about that? This is kind of fairly relatively new thing. So how did this come across your plate?
Yeah, I actually during that time period after diagnosis, I was doing a lot of research. Not so much. I was really researching clinical drug trials. And there are a bunch of different trials out there for different drugs. And when you're in one clinical trial, you cannot be in another one. So I had enrolled in a couple different failed drug trials since my diagnosis. Failed to the point where like the data isn't even close of making a difference between uh, the placebo group and the drug group. So it was like I kind of had to make a decision of neurology isn't innovating and we're not any closer to finding a cure now than we were 100 years ago. So when you get to a certain point, you have to start saying to yourself, okay, I need to find other options because I put all my eggs in the basket of a drug and hoping that it's going to work. And it's just kind of like you take 2 steps backwards. And it's so disheartening when you get the news that, the drug trial had failed. But to go off of that, how I found Neuralink was I was literally just watching TV and living in Austin. Elon Musk has a very large presence here.
Yeah.
Um, And I think I saw a news spot about P1, about Nolan. And I heard his story, how he had a spinal cord injury, and found out about Neuralink. And at the time I had no idea what a BCI even was. And, the concept of, moving a cursor across a screen, didn't really sound like that big of a monumental thing to me, but I kept doing some more research. And at the time, the inclusion criteria was much more strict. Like, it was only including spinal cord injuries at the time. But they had a patient registry form that I filled out anyways, indicating that I had partial to total paralysis, and at least my arms and my legs were failing. So I submitted this form, not really thinking anything that I would ever hear back. And then it was about 6 months later, my phone started ringing, and it was the Barrow Institute team out in Phoenix calling, asking if I had submitted that form, and B, if I was still interested in the technology, because they thought that I would be an ideal candidate to enter the trial.
Oh, sure. Yeah. Okay. Sorry, John. I didn't know if you wanted to
Oh.
anything on that. Yeah. Just so from the process, the conversations, can you just walk us up a little now to actually really getting connected with the Neuralink team and kind of having that progress happening there?
Yeah. So the first initial conversations were just phone conversations with the site coordinator at Barrow. And those were kind of just over the phone interviews, general, basic demographic information, brief health history. And then after 2 phone interviews, then I met with the clinical director of Neuralink. And these conversations probably took place over a 2-week period. And after passing that battery of, online interviews, they wanted me to come out to Phoenix for 3 days of in-person testing. And so from my initial conversation with the Barrow team, by 3 weeks later, I was booking flights to go out to Phoenix to see the team and go through all the insight evaluations. So that was 3 days of, blood screens, imaging, a lot of imaging. And after the 3 days, they said, everything looks great. We're going to present your case to the Neuralink team, for a final decision. We'll get back to you. And then it was in early June of this year that I was told that I was selected to be patient number 7. And then I had the procedure on Friday, June 13th.
Wow.
Well, I think when you initially heard back, because obviously, you hadn't heard anything for 6 months, and obviously I don't know what the queue process is like, if that's like 6 months is normal. But was there any reservations, or like had you potentially kind of moved on, or were you thinking about other things, or was it when they called, it was like, I mean, obviously it looks like 7 days after you got selected, you were there. So it's like, where were you at by the time they called you?
Yeah, so in that 6-month period, they had expanded the inclusion criteria to include people with ALS and other neurodegenerative diseases. So, I mean, it was just kind of an afterthought, once I submitted the form, and then when Sydney had called me, she's like, this is from Sydney from Barrow, and I had to like do a little quick recall, like, oh yeah, this is what I filled out, 6 months ago. And yeah, we were kind of off to the races from there. I hadn't sought out any other trials to be included in at the time. But I was very surprised when I got that phone call. Yeah.
kind of a side question, and John, you actually might know the specific number of how many patients there are today. But do you know how many? What are we up to?
I think it was like
12,
13.
13, somewhere around
They
there.
may be up to more now.
I'm wondering how many people have actually applied to be part of these trials versus the 12, 13 that are actually participating as of today. Jake, if you might have insight on that.
Oh, yeah, I don't know the number. I do know that a lot of things have to add up correctly, though, for you to be a candidate.
Yeah.
From the space in your cranium for the implant to fit, you know, the thickness of your skull, the curvature of your skull, based off the integrative MRI, you know, what nerve signals they're getting off of that. So there's a lot of stuff that kind of has to go into your picture to make you look and appear as a good candidate. But I wouldn't even know a number to guess, but I'm sure it's, you know, and I still kick myself to think about to this day that, you know, how unlucky was I, you know, to be diagnosed with this disease. I mean, it's like I have a better chance of getting struck by lightning on my way in to cash in a winning lottery ticket, you know? And then it's like on the flip side of that, you know, luck, karma, however you look at it, can kind of work both ways, you know? Like I was picked out of however many people applied for this. So I do feel a very strong responsibility, you know, to not take this lightly and to really push the science and push the innovation to as far as, you know, I'm able to do.
Yeah, you know, I was actually just about to ask you, as far as being patient 7 again within the first 12, 13 or so, just what that means to you, the responsibility that it carries, the hope that it carries. You know, we've spoken with maybe 5, 6 so Neuralink patients so far, and all of them really have expressed this feeling of obviously gratitude. It's I think you worded it great. It's like getting a winning lottery ticket and then also getting struck by lightning the same day. It's something just like such difficult emotions, but obviously such strong gratitude for being part of Neuralink's trials. But as an actual patient and part of this program, describe what it's really like for you.
Yeah, I mean, it is a tremendous responsibility, and I do take a lot of pride in the work, you know, that I do with the engineers every day. But before Neuralink, I was wanderingly, blindly, just kind of through life, kind of. I didn't really have a purpose anymore. The work that I was doing at my previous job was now unfulfilling since I couldn't really do my responsibilities. I had no purpose. I had no waking up every morning. It's like I didn't even want to roll out of bed. And then being blessed with the Neuralink, it's like I wake up with a purpose. And like when you've lost that and to get it back, it's such a profound feeling because it's like ALS, all it does is take things from you. And this was something I was getting back. And so I do feel a tremendous responsibility to do everything that I can so that, you know, the next 31-year-old Jake that goes into the doctor, you know, is a little bit more prepared, you know, than I was going into it.
Yeah. So how did your friends and family react to the idea of putting a brain implant in? Did you get the call from one of the loved ones like, I don't think this is a good idea, or this sounds like Pinky in the Brain? Like,
no, I've been blessed to have an extremely powerful and supportive support system around me. And I was kind of existing in this camp of, you know, well, I have nothing else to lose, you know? And so if anything, my family was nothing but supportive. And there's actually me, I kind of got apprehensive. I was like, wait a second, this is brain surgery after all. Like, you know, are the pros going to outweigh the cons? And even if it even if they put the implant into my head and it was ineffective, it didn't even turn on. You know, that makes it worth it in my mind, because I'm advancing that scientific process of like, okay, well, why isn't this working, and how can we do it better on the next person? So even if it gave me just a little bit back, or I gave someone else a glimmer of hope, I was all in. You know, I had nothing else to lose.
Yeah. Well, tell us a little bit. Okay, so it's like June 6th, you're getting the call. You know, you've been selected. June 13th, I mean, literally 7 days later this year, and I can't believe it's been, you know, in 2025. It's, you know, you're thinking something that happened a while back. But you know, you fly out to Phoenix. Tell me a little bit about the procedure and your recovery. What did the day look like, the first few days, and then like, you know, weeks? Like, how did
Yeah.
it challenge you physically or even mentally? But what did that whole process look like?
Well, so the first big mental hurdle that I had to get around was that my surgery date was scheduled for Friday the 13th. And, you know, I
So
don't know
can we
if
move it
you
by a
believe,
day?
I don't know if you believe in bad luck, but once it has a target on your back, it kind of doesn't leave you alone. But yeah, so I went out there. They wanted me out there a week, like 4 or 5 days. I got there on Monday. And so you stay out there Monday to the procedure date on Friday. And that's all just typical like pre-op appointment. I had to bathe with these special like sponges, disinfecting sponges. So that was it, you know, 4 days leading up to the procedure on Friday. And then my procedure was Friday afternoon. And it went, I mean, it went very smoothly. I'm told it was procedure time was just under 5 hours of operative time. But yeah, I woke up in recovery. Since I'm right-handed, the implant is located on the left side of my head. You can actually probably see it back there in the back left of my head, that kind of circular.
Yeah.
But yeah, all they do is they peel the scalp back a little bit. And all the surgeon does is drill the burr hole in the skull. And then from there, they dock the robot in. So when they dock the robot, it has all of the imaging from my MRIs. So it knows what parts of the brain to implant the threads. So all 120 threads of my implant were positioned in the different places in my motor cortex. And then, yeah, they tacked the scalp back down. And then I had, I think 17 to 19 staples in my head. But the recovery was, I mean, it was very mild. Like I had to stay in the hospital for 24 hours post-op, which I knew about. That was just protocol. So one night in the hospital, and then I was required to stay in Phoenix for another 2 weeks, just for the staples to heal. But I mean, the pain was very mild. My head didn't really hurt that bad. Honestly, I've had hangovers that were worse. But yeah, after the 2 weeks, the staples came out and I was able to fly home. But the most exciting thing was like when I woke up in recovery, the engineer team from Neuralink actually came in and they're like, "Okay, are you ready to fire it up?" And when you see the raster of all your neuron, like all your nerve signals coming through and you're seeing them real time, that was like the real holy shit moment for me. Like I have now officially crossed over and I'm not all the way human. You know, I'm part cyborg at this point. But yeah, recovery was easy. While I was out in Phoenix, the engineers came to the house every day. We'd work on stuff a little bit every day. And when I first got control of the cursor, you know, I thought I thought it would be a pretty steep learning curve, but it was quite the opposite, actually. I felt like I picked up the cursor control very quickly. It seemed like a very intuitive thing to kind of remember, and it all was pretty seamless, actually. Like, you had to remind yourself that you actually had brain surgery because it felt very minimally invasive. The team was great. I have no bad things to say about the hospital staff, the surgical staff, the Neuralink team. They've all been incredible.
So, Jake, about the actual implant, and you described it a little bit there, but there was a funny post you had on your X. You said, some charge their car, being Tesla owners, I found this funny. You said, some charge their car, I charge my brain.
Yeah.
So it's not like you could like take an outlet and stick it in. It's like, what do you actually do to charge up the implant? There's clearly batteries. There's a lot going on there. It's not just something passive.
Right.
So what's that like?
Yeah, so there's a battery in the N1 implant that you need to keep charged. It charges much like an Apple Watch does, so it kind of has a little coil that goes inside of a baseball cap. You put the baseball cap on your head, and as long as it's hovering over your implant, the charger will kick on and start charging you up. Takes probably about, if the battery's like all the way down to like 5 or 10%, takes usually about 45 minutes to an hour to charge all the way back up. And then you'll get about 6 to 7 hours of use out of that, depending on what sort of applications you're running. But yeah, it's pretty seamless and easy. The only stipulation is that you can't sleep with the charger on. That was one of my first questions. And like, no, you could just, what I basically do is I'll turn on Sports Center in the morning. And by, that hour-long program of Sports Center, I'm usually charged up and completely ready to go.
Yeah, that makes sense. Kind of, yeah, it's just kind of it's crazy how that works, but it also makes sense that the battery would be used more if you're also like using a ton of applications, or I don't know if there's more intensive applications that suck the battery, but it also makes sense. But
yeah, out of the box, it only has like, I think like 15% battery. So for those first couple days post-op, when the engineers are coming to the house, like, we turn it on, do what we need to do, and then immediately turn it off. So we would, consume that, because you couldn't charge the implant until the staples came out. So I had that 2-week period where we couldn't charge, but we still needed to get work done every day. So it would just be sessions where we connect and then disconnect. But then once we were able to charge it all the way up, I think I probably consecutively was on this thing for close to 24 hours. I mean, it was like, it's like, when you get something back, it's like, I couldn't put it down. It's like,
Yeah.
I felt like I had, my arms back, and it felt like I was zooming around on this computer almost as fast, if not faster, than when I was, not sick.
Yeah. Before, so, obviously, because it's crazy to think that you just got your Neuralink 5, 6 months ago. What were you using to communicate or control devices before Neuralink? Like, what other options were out there if you were exploring anything?
So not a whole lot. Obviously for me, the weakness started in my shoulders and spread to my hands. So once my hands were compromised, moving the mouse around, I had to move it around with 2 hands. I could only peck like 1 key to type. So I was getting by using voice dictation, which isn't a perfect system. I mean, especially if you're in a room where someone else is talking, or you have the TV on that can pick up the audio and transcribe it. so yeah, I was just kind of getting by with the voice commands, and then when I wasn't connected to the Neuralink, I'd be fumbling around my iPhone, which I get it, it's 2025 and we want to make things bigger and better, but I would kill for just a tiny, tiny, lightweight iPhone. Like, give me a Gen 1 back. That would be easier for me to hold. But yeah, those are my big challenges, because I couldn't really communicate effectively on my phone, via text. So I found myself calling people more often than not, or not responding to text messages, and I didn't want people to think I didn't like them or anything. It's just, it's hard. It's hard to respond. We take for granted all the things that we can do easily every day, and when they become a challenge, it's just another challenge that you have to try and get through every day. So that's kind of the biggest thing, is stacking up these challenges every day, and just getting through tasks to get my day started.
On that same topic, once you received the Neuralink, what were some things that maybe you thought would have been impossible as life was, and then afterwards it was like a profound difference?
I think one of the biggest things for me, like, I always loved playing Xbox, PlayStation, and it got to the point where I can no longer grip a controller, and that really sucked, because when you lose those things, you're like, man, I'm never going to be able to do that again, And my son, he's 6 years old, so he likes playing his Nintendo Switch and whatnot. And so when they told me that I could connect my Neuralink to the Nintendo Switch and play Mario Kart against my son with just using my thoughts, I was blown away. Like, my jaw was on the floor. It was the most profound thing. That was like, 15 years ago, I had a flip phone and I was texting using T9. And now I have a computer chip in my brain that's allowing me to, throw red shells at my son from across the map, So it's like things that I never thought I'd be able to do again, I've been doing. And one of the projects we're working on is developing a dual joystick model. And in working with it a few times, I've actually dropped into the campaign of Halo and played Halo a little bit, which was my favorite video game. So, like,
That's awesome.
I mean, to get your wings back after they've been clipped like that, it's not like anything I can describe to you, but it's the most profound feeling I've ever experienced.
So even you just had a phone call, I guess, come through something on your screen. Do you just look over to it and press like cancel?
Yeah.
Just by thinking.
Yeah. So right now, like, moving the cursor for me, I don't even have to think about anymore. So, like, when you're first training the model, you're imagining moving your hand across your desk. If you want the cursor to move left, you just imagine moving left across your screen. And now, I really don't even think about it. I just kind of look where I need it to be, and it's almost there before my eyes are there. And then you're able to have 3 clicks calibrated. So you have your left click, your middle click, and your right click. So, to answer that call, I just hovered my cursor over the red button and thought about making a left click to hang up, and hangs up.
Yeah, that's just crazy. How would you say, your daily routine has changed since getting the implant, in terms of like independence, interactions with others, and just overall outlook? I mean, you've talked a little bit about that, but kind of maybe, a way to just kind of bring it all together with this question.
Yeah, I mean, like I had said earlier, I kind of got my purpose back, or my mojo, my swagger was back. Like, before, I was waking up with not even really caring about life anymore, and being in some really dark places. It just pulls you right out of it. Like, I wake up every day, thinking about, what me and the engineers will discover today, because we're discovering new things that this can do every single day. And I love being part of that scientific process of trial and error. So really my outlook on life, I had an outlook on life again. It gave me a new lease on life, not so much in the sense of, more in the sense of, I know what time I have left. It is a finite amount, but I'm going to try and squeeze every ounce of, living I can out of that time, and just try and leave the world in a better place than I found it.
Yeah. And, I was thinking about it too, just previous patients we've spoken with, but there's even some other technologies, like this robotic arm. I think Nick Ray got to use. I think Alex, I believe is his name. He's had some experience with it. As far as I understand, all Neuralink patients here are quadriplegics. But is that something where you've been able to have any experience with some of that breakthrough tech?
Yeah, so I've done, so the robotic arm is called the Convoy trial. And I've done all the online calibrations for the model. With a robotic arm being an external device, the FDA requires that if it's being used, and the engineers have to be present, in the event that they leave my house and I inadvertently, throw my dog across the room or something like that, to mitigate any injury or anything breaking. They're here the entire time. I have not had the in-person visit for the robotic arm yet, but I'm told I should be able to experience that soon. But even in talking with Nick, who's P8, another ALS, patient, he said, in listening to him talk about his experience with the robotic arm, being able to talk with his hands again, he was holding a mug, and having a conversation and, gesturing just like he normally would before. And so, although I haven't experienced it yet, I've seen how groundbreaking it has been for the other participants, and I'm really excited for my turn.
Yeah, I think personally I'd rather play some Mario Kart, but the robotic arm is pretty cool.
Yeah, the main project I've been working on is a typing program. So we're developing a new keyboard to auto lay over the top of just a normal text field, and the movements and intended movements make it feel just as fluid as if I was typing normally on a normal keyboard. So that's what I've been working on as of late, trying to get that up to the words per minute that a human would be able to type. And we're very close. We're very close.
That's awesome. Especially too, because this keyboard and the stuff that you're working on is going to help the next patients that come through, especially as they continue to add more and scale. So you're not, what's awesome about literally what you're talking about is you're not only a patient, an advocate, you're literally kind of almost becoming a test engineer in some ways and helping them QA the whole thing, right?
Yeah, and that's what's really cool, because it's the Neuralink team, they don't have implants of their own, right? So it's they're relying on our feedback 100% as to how we can innovate this product and make it better. So it's a very collaborative back and forth, process of, we'll work for 2, 3, sometimes 4 hours a day. So it is almost like a full-time job in that sense, but the fulfillment and gratitude and purpose that this has brought into my life has been nothing short of incredible.
Yeah. And is there, kind of a little quick follow-up, what does it mean to you to be able to share your story? I mean, thank you for taking the interview with us, but what does it mean to you to be able to share your story and obviously even help advance the product that's helping you and changing your life?
Um, to me, like I do have a strong sense of responsibility in that, there are tons of other people who are probably in my same situation or were in the same spot that I was. They're scared, alone, don't have any answers. Um, so me sharing my story helps just one person get some clarity or helps one person find some new options that might be out there for them when everyone else has given up on them or told them like there's not anything else we can do for them. Like if my experience can give hope to someone else who has lost it, like even if it's just one person, it would make it all worthwhile.
Yeah, I mean it's an incredible story, Jake. Like from just the young 30s, finding out that you have this disease where a doctor goes, okay, you have 5 years left to live, something along those lines, and seeing your body almost betray yourself to. I love the way that you put it before too, having getting struck by lightning, but also having a winning lottery ticket at the same time, and just this kind of a emotional roller coaster. But also, I mean, one thing that we've seen from all Neuralink patients we've had the honor to speak with, including, of course, yourself, is there's such an immense level of gratitude from every single one. And not just the gratitude, but this strong responsibility to, as part of these trials. And I love what you said before, too. You said, even if they put the implant in and it didn't work, it helped. It helped. Something got accomplished in that way. They're going to be able to learn. Nolan he shared that same, okay, like even he might have said this, I don't want to put words in his mouth, but even if I don't make it out the other side of the surgery, at least they're going to learn. And there's a great thing that Musk has shared in the past where he said, you have to wake up in the morning and you have to be excited about things. You can't just get up and there be problems and problems. And I think for myself, just from this conversation too, you see how Neuralink isn't just about restoring some capabilities, but it's what I've seen the most now is that it's also restoring hope, and that's so important.
Yeah, and one of the biggest factors for me with going forward and pursuing this is I've got a 6-year-old son, and he's watched as things get taken away from me. I can't do things that other dads can do. Like I can't ride a bike with my son or throw a ball with my son, like other dads can. But I can do things now that other dads cannot. And my son, he thinks it's the coolest thing in the world. Like he doesn't probably understand fully what's going on physically, but I want him to be able to look back one day and say that, my dad did that. And no matter what, he never gave up. So like, if he can see that example that, the world is what you make out of it. And sometimes you have to go out and find your own answers. And I want my story to tell that, it's like when you're down to nothing, God's up to something. And the brilliant minds that work for this company, I mean, they pour their heart and soul into this, and it's just such a great team to be part of.
Yeah, no, it's just inspiring, kind of some of the stuff you were saying, but looking ahead, for yourself, what are you most excited about, whether it's for yourself, or, just your continued use of the implant, or the possibilities of what Neuralink could open up for others? What's on top of your mind as you think of the next couple of months to year?
Oh, yeah. I mean, I think innovating this product and making it, obviously the goal is to get this to a point where it's a commercially viable product. But being able to help prove the safety and efficacy of the product in this next year, like the amount of leaps and bounds that we've made in just a couple months that I've had it, like the excitement for what the future holds is crazy. Like I want to get another implant. I want them to put one in on the right side of my head, on the right side of my brain. I want to be able to control and communicate with the Optimus robot someday. And I hope someday they're able to use this technology in some sort of prosthesis that can give people the ability to walk again, or give the people the ability to write or throw a baseball or hug their loved ones again. You know, those are the things that I really get excited for, and seeing how many patients we can get, and what our global reach can really be.
Yeah. Just before John wraps us up here, I want to make sure that we do point to your, there's a GoFundMe, I believe it is, on your X account. Your account is paired with _P7. Even if you just want to give a quick breakdown of what the GoFundMe is. I know it's been doing great, really, really happy to see that. If you just want to share a little bit about that, and then we'll have John wrap us up.
Yeah. Thank you so much for plugging that. Yeah. GoFundMe was started to help. I want to stay in my home as long as I possibly can. Obviously that requires renovations to help it make the home more accessible. And those are expensive. So the tremendous generosity and outpouring of support that I've seen from people, it restores my faith in humanity. It really does. I have an incredible support system, and I'm blessed to be in the situation that I'm in, which is really, really weird to say. But I really am, because it's something that my life was flipped on its head, and I've been able to flip back over, and now the sky's the limit almost. Next stop, Mars.
Pretty much. Yeah, well, Jake, thank you so much for sharing your story. If you're watching on X, where the majority of you are, or even YouTube, we've posted the link in the thread, so you can go and help Jake further, and help him, get access to the things that he needs. And then also in YouTube, it's in the description. So, but Jake, we just want to say, first off, just thank you so much for your story. Thank you so much for just coming on and just, being a part of these trials to really help out people, other people that may have, similar situations as you, with ALS, and really just, again, all of the Neuralink patients, all of the work that you and each patient is doing will help us further, helped out other people with disabilities as well. So, I know it's, you're on an incredible journey. We're rooting for you. And again, thank you so much for your time. Make sure to give Jake a follow. Again, he's tagged on this X stream, but just to call it out, it's at paired with _P7. So we're really happy or we're really thankful for this time that you've given us today. And, hopefully, you can reach your goal at the GoFundMe, and, keep fighting. And we're here to support you along the way.
Yeah, guys, it was my pleasure. Thank you so much for having me on, and thank you so much for taking care and watching this journey with me. I really appreciate it.
Yeah, God bless you, Jake. Keep on pushing, man. You're inspiring a lot of people.
Thank you guys so much.
Thank you.
See ya.